And so when we look at a person who has mental illness, how do they respond to exercise? There really is no variation by the type of mental illness that they have, but it's going to be affected more so by the medications they take, as well as any other chronic diseases that they might have, like heart disease or diabetes. They definitely can improve their fitness. They can exercise does improve their mood, and we've got a slide on some of the research with that. Increased anxiety and depression, and we'll talk in more detail about the Done It All study, the 2005, but there are plenty of other studies that demonstrate the efficacy of exercise in treatment for persons with depression. Here are some of the medications. Probably be familiar with these, that you might want to recognize these when you're working with clients, since people will take these medications. So people who have schizophrenia will take a drug called clozapine or Clozapil, and that is the one that does tend to cause weight gain. So that could be an issue for a lot of people that have these medications. And then when you compound that a lot of people with mental illnesses tend to be inactive, so it further compounds that. Antidepressants like Paxil or Celexa, so that also has a side effect of weight gain. So they do work on the brain chemistry. And then when you look at anti-anxiety medications, Xanax, lorazepam, Valium is another one that you could add in there. So people have to be very careful because those are addictive. They can make them very drowsy, and if people are using alcohol, it can be dangerous and deadly. When you're going to test people with mental disabilities, you have to consider how they're doing from day to day. And they may need some familiarization, some practice trials with the equipment and the type of setting, especially if they're having, if they're prone to psychotic episodes or they have anxiety. If they may be on beta blockers that may slow their heart rate, they may not be as motivated because of medication effects. Some antipsychotic medications can cause disturbances in their gait as well. The cycle, the Monarch cycle, may be more better for persons than a treadmill-based or a walking-based exercise. But, otherwise you can do your lab testing with, the 1 mile walk test or a treadmill submaximal test or the YMCA. You probably don't want to use metabolic cart on them. It's probably may induce some anxiety. And if they also have other chronic diseases, then you have to look at that in the whole picture in working with that client. Training for persons with mental disabilities, trying to focus on the enjoyment and the adherence, because with their mental, the benefits of exercise with mental illness, being consistent is going to be better. So basic ACSM recommendations, so that 3 to 5 days a week, get that 20 to 60 minutes, 11 to 14 RPE, 40 to 60% VO2 max. Walking, running, group fitness. The Back on My Feet program is described on Blackboard for the group, the running group that started out with in recruiting people from a homeless shelter, and it's helped them transition to educational opportunities, job opportunities, and getting back to their independence, but running was the initial way that they did that. Resistance training, same thing, 2 to 3 days a week, your standard ACSM recommendations, and flexibility training, just like as you would train any other adult. And then look at the case study. In the Chronic Disease and Disabilities textbook, they have a good mental illness case study.